Do you often feel tired even after a good night's sleep? This could be more than just ordinary exhaustion. You might be dealing with chronic fatigue syndrome, or CFS, a complex disorder characterized by extreme fatigue that can't be explained by any underlying medical condition. CFS is more common than you might think, affecting millions of people worldwide. It's a condition that can significantly impact a person's daily life, making even the simplest tasks seem insurmountable. The hallmark of CFS is a feeling of constant overwhelming tiredness that rest doesn't improve. But the symptoms extend beyond fatigue. Individuals with CFS often experience post-exertional malaise, which is a worsening of symptoms after physical or mental activities. They might also struggle with unrefreshing sleep, memory and concentration problems, and a myriad of other symptoms. Stay tuned to understand the symptoms, diagnosis, and treatment of this condition. So, what does chronic fatigue syndrome feel like? It's more than just feeling tired all the time. It's a complex condition with a myriad of symptoms that can significantly affect a person's daily life. One of the most defining symptoms is persistent fatigue. This isn't your ordinary, "I didn't get enough sleep last night" kind of tired. It's a profound, debilitating exhaustion that doesn't improve with rest. This ongoing fatigue can make it incredibly challenging to carry out even the most mundane tasks like brushing your teeth or making a cup of tea. Then there's post-exertional malaise. This is a worsening of symptoms after any kind of physical or mental exertion. It's not just about feeling tired after a workout. It's a disproportionate crash that might come hours or days after the exertion and can last for days or even weeks. Unrefreshing sleep is another common symptom. People with chronic fatigue syndrome often wake up feeling just as tired as when they went to bed, regardless of how many hours they've slept. This lack of refreshing sleep can further exacerbate the fatigue and make it harder to function during the day. Memory and concentration problems are also prevalent. Often referred to as brain fog, these cognitive difficulties can manifest as short-term memory issues, trouble concentrating, or difficulty processing information. This can affect a person's ability to work, study, or even carry out simple tasks. Lastly, orthostatic intolerance. This is a condition where symptoms worsen when a person stands or sits upright. It may cause dizziness, lightheadedness, or fainting, and can make it difficult for a person to stay in one position for extended periods. These symptoms are not exhaustive, and they vary greatly from person to person. Some might experience additional symptoms such as pain, sensitivity to light, or gastrointestinal problems. If these symptoms seem familiar, it's crucial to seek medical attention. Don't dismiss persistent tiredness as just a part of modern life. Chronic fatigue syndrome is a serious condition that requires professional diagnosis and treatment. Diagnosing chronic fatigue syndrome isn't as straightforward as you might think. The elusive nature of this condition means it's often diagnosed based on a combination of medical history and physical examination rather than a simple test. The United States National Academy of Medicine has proposed a set of criteria for diagnosis, which includes persistent fatigue, post-exertional malaise, unrefreshing sleep, memory and concentration problems, and orthostatic intolerance. For a diagnosis of CFS, these symptoms must have been present for at least 6 months, with a moderate, substantial, or severe intensity at least half of the time. Your healthcare provider might suggest additional tests to rule out other conditions. For instance, blood or urine tests could be recommended. If sleep apnea, a condition that can also lead to fatigue, is suspected, a sleep study may be suggested. Similarly, if there's a possibility that certain hormone levels may be low, causing adrenal insufficiency, which can also result in fatigue or weakness, further testing may be required. However, it's worth noting that if you have unexplained chronic fatigue but few, if any, of the additional symptoms, you may have what's known as unexplained or idiopathic chronic fatigue. This is considered a different problem and may be managed differently than CFS. It's important to remember that a diagnosis of CFS is not the end of the road, but rather a step towards understanding and managing the condition. It allows healthcare providers to work on a treatment plan tailored to your individual needs, focusing on reducing symptoms and improving your quality of life. In the end, diagnosing chronic fatigue syndrome is a nuanced process that requires a thorough understanding of your symptoms and medical history. It's a condition that demands careful attention and a comprehensive approach to manage effectively. And while there may not be a simple test to confirm it, a careful and thorough diagnosis can pave the way for a personalized treatment plan. Diagnosis is the first step towards managing CFS. While there's no cure for chronic fatigue syndrome, many treatment options can help manage the symptoms. The primary goal of treatment is not to find a cure, but to alleviate symptoms and improve quality of life. It's important to remember that there's no one-size-fits-all approach to treating chronic fatigue syndrome. Each person's experience with the condition is unique, so the treatment must be individualized to address the symptoms that are most bothersome or interfere most with life. For some, this could mean focusing on treating pain or sleep problems. Medications such as non-steroidal anti-inflammatory drugs, also known as NSAIDs, or a low dose of a medication called amitriptyline, can be used to manage these symptoms. Physical activity, while challenging for many with chronic fatigue syndrome, can also be beneficial. But this isn't about running a marathon or hitting the gym for hours. It's about finding the right type and amount of activity that you can tolerate to help keep your body active without worsening your symptoms. It's about understanding your personal limits and working within them. This might mean taking a short, gentle walk around the block, doing some light stretching exercises, or even just moving around your home. The key is to stay as active as you can without pushing yourself too hard and causing a flare-up of your symptoms. It's also essential to work closely with your healthcare provider when creating your treatment plan. They can help guide you through the process, suggest various treatment options, and monitor your progress. By working together, you can find ways to manage your symptoms and improve your quality of life. It's important to remember that managing chronic fatigue syndrome can be a long journey. It involves a lot of trial and error, patience, and understanding. But with the right treatment plan, support from your healthcare provider, and a commitment to taking care of yourself, it's a journey that can lead to a better, more comfortable life. Remember, managing CFS is a collaborative effort between you and your healthcare provider. There are many treatments out there claiming to cure chronic fatigue syndrome, but not all are proven or beneficial. In the realm of unverified treatments, graded exercise therapy often emerges as a controversial topic. It was once recommended by many healthcare providers based on a study that unfortunately was later criticized for its significant limitations. Many individuals living with chronic fatigue syndrome have reported that this type of exercise actually exacerbates their symptoms rather than alleviating them. This doesn't mean that physical activity should be entirely ruled out. Quite the contrary, maintaining a certain level of physical activity can be beneficial. However, the key lies in understanding personal limitations and working within them. It's essential to consult with your healthcare provider to determine the type and amount of activity that is most likely to benefit you. It's easy to fall into the trap of overdoing exercise, especially when you yearn for the active life you once had before chronic fatigue syndrome. But it's crucial to remember that overexerting oneself can lead to what's known as post-exertional malaise, a worsening of symptoms following minor physical or mental exertion. In the same vein, there are numerous dietary, behavioral, and medication interventions that have been evaluated for treating chronic fatigue syndrome. Some have shown no benefit, while others have results that remain unclear. It's important to approach these treatments with caution, always in consultation with your healthcare provider. The journey with chronic fatigue syndrome is undoubtedly challenging, filled with uncertainties and trials. Yet, it's important to remember that you're not alone. Many others are walking the same path, and there's a whole community of healthcare providers, researchers, and fellow patients ready to offer support. Understanding chronic fatigue syndrome is the first step towards managing it. It's about learning to navigate this new normal, to find ways to live a fulfilling life within the confines of this condition. Remember, you're not alone in this journey.